welcome to Hip Pain Moms Unleashed. Today, I have a super excited to be chatting with Janelle, who is a massage therapist that specializes in neuromuscle massage and corrective exercises. Thank you for being here. Before we dive into your details, could you tell us a little bit about how you got started in this field?
Yeah, so I also had some hip pain, believe it or not. Before I ever discovered massage, I was a personal trainer and working in a PT clinic, and I was weightlifting about 6 days a week. And then I made a switch in my schedule and I switched to exclusively running. And that fired up an issue in my hip and low back where my leg was giving out. And I was trying all different sorts of therapies to try and help myself, consulting professionals, going to all different treatments, and it was actually a massage therapist who was doing active release technique on me that was able to get me some long lasting relief. So that's kind of how I discovered the field of massage, and ended up going to school for it. And here I am.
Well, that was going to be my next question. What drew you to the work? So you already got that all taken care of. All right, let's talk a little bit about hip pain. It's a major issue for many women that are pregnant, especially with the way our bodies go through in postpartum. Can you break it down why hip pain is so common during pregnancy and what happens in the body that makes this area particularly prone to discomfort?
Yeah, so you're right. It is common. The one of the big factors, obviously our bodies are going through a ton of changes throughout pregnancy period. Our bones are shifting. We produce a lot of relaxin, which is a hormone that gives the body extra elasticity in the ligaments so that your body can create that movement and that change as it's growing to accommodate the baby.
Mhm.
So, when things are adjusting to that growth and those new positions, let alone the different muscular structure, like there's going to be some things that possibly get a little bit out of line. You can have trigger points that develop, so all of those will play into some increased discomfort. Plus, you're having a lot of demand on your pelvic floor, so that's a whole nother area that can be involved, and we can get into that a little bit later too. But yeah, it's all the changes and the hormones, and then of course you're not sleeping your best. You've got all sorts of different things that you're researching in the middle of the night when you're not sleeping, and
Yeah.
just kind of from an overall health standpoint, that plays into it as well.
Are there any early warning signs that mom should be aware of before the pain even gets bad? Is there a way to, I guess, not stop it fully because obviously what our body goes through, but how can we prevent it as best
So
as we
there's a
can?
couple of different aspects. You can play into your overall health, right? And obviously in the first trimester, like a lot of women end up sick. Or, some women end up sick. They're throwing up, they're not feeling well, they may be dehydrated. And honestly, it sounds so simple, and it is. Dehydration plays a lot into our pain. So making sure that you're trying to stay as hydrated as possible, electrolytes, water, obviously, and then your overall nutrition. There's going to be cravings and things to give into, but the best you can do to try and still eat a well balanced meal, still get some daily activity. It doesn't have to be anything aggressive, but going for a walk, as simple as that sounds, does help a lot, to keep our bodies moving. And then, that a lot of people tend to ignore their pain. They think, oh, it'll just go away. So when your body starts
Yeah.
to have pain developing, like a lot of times it does start with something that's just occasional, and then it goes away and we're like, okay, not that big a deal. I'll wait until it gets worse. And then, of course, as pregnancy progresses, you're not encouraged to usually take a lot of, over the counter pain relief. So I can talk more on, some things that can help, once that pain starts to set in. But in terms of prevention, like, staying hydrated, eating good meals, managing your stress as best you can, taking it one day at a time, with learning what you're in for, especially if it's your first pregnancy. Like all of those are good things to kind of implement in the beginning, for sure.
Yeah, absolutely. Add on to that if you'd like to, if you wanna. I know you said you want to get into that later, but if we're on the topic, let's do it.
Okay. Yeah. So, women may have a pain that comes up, in the front of their hip is a really common one. Sometimes that can be round ligament pain, and that is literally from your uterus expanding to accommodate baby. So that typically is going to start setting in kind of in the beginning of the second trimester, maybe a little bit towards the end of the first trimester as that baby's really starting to grow. And there's added weight on your pelvic floor. So, they're paying attention to those sorts of pains. You can do a lot of good for yourself with a foam roller at home. Rolling out any areas like any musculature that feels sore. That's my favorite thing. Like, I'm not really a big Theragun or stretching person. I
Okay.
much prefer more of like the at-home self myofascial release. So just a inexpensive foam roller. It doesn't have to be the one with all the intimidating nubbies on it. Um, but yeah, they don't have to get the scary ones. But those really will help. You just kind of rock back and forth and find tender points. And then, sit on it for a little bit, let the weight do the work. So those are really good to just help keep the circulation in that area, because one of the main things that happens as muscle discomfort sets in particular, is a lack of circulation. So the more circulation that area has, the better it's going to feel. um
Okay.
and then, I mean, you're like, there's other things that are a little bit outside of the scope of a massage therapist, right? So if you're starting to notice that you have trouble with any like incontinence, which is super common in pregnancy, especially if it's after your first one, any painful sensations with your pelvic floor, you definitely want to start setting up some appointments and consultations with a pelvic floor physical therapist, and they can help teach exercises. I think a lot of times there's this tendency to think like, oh, must need to, tighten up and strengthen. I must be not able to like hold my bladder because I'm so loose. But a lot of times it's just learning how to control those muscles. And that I love pelvic floor physical therapy. It's, finally really the last few years starting to get more accepted and more common for people to hear about it, so I think that's a fantastic resource.
Believe it or
um
not, I did not hear about pelvic floor therapy until about 9 months ago.
oh, really? Okay.
Yes,
Yeah.
so I'm glad you mentioned that because it's not something you hear common, and it's not something even our OBs are talking about, and you think
Uh-huh.
that area they would, but no, I'm so glad you mentioned that.
Yeah, and it's funny too. Like, being in this field, sometimes I do forget, the different, like, it depends on who you know, and it depends on if you have friends that are comfortable talking about it. Because I know, after my first kid, I asked for help for pelvic floor therapy. And I was having trouble, and so asked my doctor, like, hey, can I get a referral for pelvic floor therapy? And she says, well, what are your symptoms? And I was like, well, I can't hold my bladder, like, and it's not cute. I would like some help with it. And
Yeah,
her response, she kind of smirked at me, and she's like, well, you're not alone, it's very common. I was like, well, there's a difference between common and appropriate. Like, I don't have to just deal with this. And so I did
exactly,
get it.
and
Yeah.
I think that's the struggle is that they kind of push it off with no matter the symptoms, is that we have to just deal with it because it's part of being a woman. It's like, no, there's so much more deep in it. I was told my hip pain would go away after I gave birth. That's a lie. I
Yeah.
struggled for 7 years and still nobody could tell me exactly what was going on until my 13th doctor. So it's like, don't give up. There is so many resources, but the resources that are available, they're not talked about enough, I don't
Yeah.
think.
Yeah,
So
I
I'm
agree.
so glad. I'm glad you brought all that up. So let's
Yeah.
talk about how prenatal massages help. So what how exactly can a massage help alleviate hip pain for women or even whether it's while they're pregnant or postpartum, and what makes it different from a regular massage?
Yeah. So, and I also want to talk about some misconceptions with pregnancy massage to start out. So, there's this tendency when you're looking around for a place to get a prenatal or pregnancy massage.
Mhm.
You might see on websites or listed somewhere like, pregnancy massage is not safe in the first trimester, or you can only come in the second or later trimester. And that stems, I think, from both. like some kind of corporate CYA type policies, and just general like people being afraid to give women a massage in the first trimester. You know, there is in the first trimester in general an increased risk of miscarriage. So that is where that kind of tentative policy comes in place. And yeah, miscarriage, that I mean, that's just a fact. It is the highest chance in the first trimester. I have friends who have lost babies in all of the trimesters. I know people who have delivered stillborn babies. Like, it's not something that I take lightly. I have my own two kids. Like, it's a very serious thing, but the getting a massage in your first trimester in and of itself does not increase the chance of a miscarriage. So sometimes women are afraid to get a massage in that first trimester, and I just wanted to take the opportunity to kind of put those concerns to rest. You know, obviously, if a woman doesn't feel comfortable, sometimes they're not feeling well enough anyways in the first
Yeah.
trimester to come in for a massage. Like, that's totally fine. Um, so, what makes a prenatal massage different than your regular massage? First of all, is going to be positioning. There's kind of an even split in the massage field about having a woman lie on her side for a massage, and then also using the pregnancy bolstering systems.
Okay.
I think either one of them, honestly, are considered safe. And there's always going to be a little bit different opinions about that, which is fine. Some women aren't quite the right size for those pregnancy condition or cushions. Like, they're just not comfortable. They may be a little bit bigger or smaller than the cutout. So I usually do my massages for pregnancy side lying. We use a bunch of extra cushions and pillows to make mom comfortable while she's on the table. And then there are some things that a prenatal therapist needs to be trained in when they're giving a massage. So um, especially if there's some high risk conditions with the pregnancy itself, if there's gestational diabetes, any blood pressure concerns, we definitely need to know about that. There are some cautionary areas, like, for example, the inner thighs. There's a lot of musculature along those areas where we need to be cautious of not doing a lot of deep work. Um, because there is a little bit higher risk of blood clotting with pregnancy. So especially if there's anybody who has risk factors for that, we're going to want to be aware of that.
So
Um,
how would somebody so say they go and call to get a prenatal massage. Should they call and ask if somebody is specializes in that? Should they lay
yes.
all their history out before the appointment to make sure that they get the right therapist, or how should they go about doing that?
Yeah, so I really like it when clients call and ask us a couple of questions before they book, just so that we know that
Okay.
we're going to give them the best quality of care. Because sometimes people don't know that if they have vascular issues, that makes it contraindicated for us to give them, certain types of massage. So we can talk with them. Usually that client has been to their prenatal appointment, at least the first one already. If they haven't, I mean, a lot of women don't even know they're pregnant for the first several weeks. So, like, we may
Yeah.
massage them before they even know they're pregnant. So usually, that early, there's not a whole lot to be concerned about. If it's somebody's, subsequent pregnancy and they had a high risk pregnancy in the past, we definitely would want to know about that as well. Um,
Okay.
so yes, having a certified prenatal therapist that has actually trained in the contraindications and just things to know about working with pregnant women is an excellent idea. I have a couple therapists that have taken their training through the Somatic Institute. That's a really good online course. There's some others, around the country. There's tons of prenatal
Mhm.
classes out there. But most like basic massage schools will just kind of teach maybe like a couple of weeks of prenatal. Having somebody that has been trained, is familiar with even just the draping on a basic level. You're laying on your side and working with the sheets is just a little bit different than somebody who's laying face up or face down. So yeah, those are, but you definitely want to be with a prenatal certified therapist and not someone who's
Okay.
just taken like a basic level training. Yeah.
That's good to know because I did not know that there was many other levels. So that's great to know.
Yeah.
So is there like like what specific techniques do you use that target like the hip area and how do they work? Like, is there certain pressure points in there that could, like, what is it? Induce labor? Because I know that some people
Ooh.
say go get a massage to induce labor. So do you like steer away from it unless they ask for it or
So you bring up an excellent point. I'm glad you brought that up. So that's another kind of misconception. Um, the body is going to go into labor when it's ready, right? There
okay,
isn't a whole lot, there's things that you can do to help bring on labor, right? And some people know about these and some people don't, so I'm going to mention a couple of them just to throw it out there. When you're ready,
okay,
when you're at the end of your pregnancy and you're, at your due date, baby's medically ready to go. Like if you want to start labor, you can do nipple stimulation, you can have sex, you can do the curb walking, like all of those things can mechanically, help kind of either start labor or help keep it progressing. But massage, there you can Google, for articles about like how to start labor, and you might see something about acupressure points or acupuncture points. It's the
yes,
same thing. Acupuncture would be stimulating those points with the needles.
okay,
Acupressure would be what a massage therapist would do, and putting some fingertip pressure on those points. It has to do with the meridians in the body. So, for example, some places will say we can't work on the lower legs, or we need to avoid the pressure points in the legs. That was actually something that was taught in my basic massage program. However, the more advanced training that I took with prenatal basically says you cannot stimulate those acupressure points from such brief touch. That would be something more like you're stimulating those points. They actually make these little, like very small needles that have a band aid on the back of them that you can put on that point and stimulate it for a period of several days. That's something that an
okay,
acupuncturist would do from with a Chinese medicine background. That's not something that we're going to do with massage. So,
okay.
like
So that
my yeah, you're not going to put somebody in labor by massaging their feet, by, doing some brief massage on their lower legs. Like you would have to hold that pressure for like a sustain like hours and days. Um
okay,
so granted, in my prenatal massage, am I gonna deliberately, work on any of those pressure points? No, I'm gonna go past them and not target them specifically.
okay.
Um yeah.
So even if the like for hip pain, so say mom comes to you and like, hey, I'm really having problems with my pelvic hip area. Can you help me massage it out? For me, it was my hip flexor that gave me the
hmm
biggest issue. And then, so is there certain techniques that you can do that will help the mom?
Yes. So a lot of hip pain is also related to the glute muscles. So that's all fully
Mhm.
accessible during pregnancy. It's a little tricky to work on the hip flexors in the front of the hip. So you're talking psoas and iliacus. Because psoas runs basically right underneath where baby's at. I can't
Okay,
access psoas during pregnancy. I can get at iliacus a little bit. And so what I'll do is start with myofascial technique. So myofascial is kind of where you apply a shearing force to the skin and the
okay,
fascia. And so it's not like diving down into the tissue, similar to a deep tissue massage. It's actually more of like just trying to shear. Think of like when you glide your fingers over saran wrap, it's like creating that myofascial shear, and that
mhm,
it's a real slow subtle technique, and it helps to calm that area down, helps mobilize the tissue and increase circulation. And so I'll start with that to kind of warm up that area, and then I can also do some skin rolling. I like doing
okay,
more of like deep tissue, or a technique called a spontaneous muscle release technique, or SMRT for short. SMRT is this really useful technique. It's gentle on the body. It's a series of very targeted holds, and you basically like you the concept is you compress the joint, and that gives the muscle permission to relax. So think of like an overstretched bungee cord. Like you're not going to
okay,
get that bungee cord to chill out and relax by trying to like jam an elbow into it. So instead you kind of give it some slack, and you just wait for the body to release that tension. And so what that does is help get rid of trigger points. And
Okay.
trigger points, or a lot of people refer to them as knots, they are kind of like this palpable piece of tissue in the body that doesn't have good circulation, and it can refer pain to other parts of the body. So, for example, some of the trigger points in the back of the hip and the glute muscles, they can refer pain all the way down to the leg. And that is it's kind of something that I see where women will think that they have sciatica. They're coming in and they're complaining of
Yes.
pain shooting down the back of their leg. And I'll ask them, well, does it go all the way to your ankle, or does it tend to stop around your knee, or maybe a little bit higher than that? If it's not going all the way to their ankle, I have a really high success rate of getting rid of that pain, because that means that it's actually coming from trigger points in the glute muscles.
Hmm.
Um, and that's something that, we see that all the time, pregnancy or not. And that has to do also with the nerve that's coming out from the lumbar spine. So the sciatic nerve comes out from the lumbar spine, passes through the glutes, and runs all the way down the leg. And so typically, if somebody's saying that that pain is going all the way to their ankle, that's going to be more likely related to the lumbar spine. So we can do some myofascial along the rector spinae muscles along the lower back.
Hmm.
Even with pregnancy massage, like you can still do a lot of meaningful work when someone's pregnant. Sometimes, like, I have clients that say, they went for a prenatal massage and they didn't really do anything besides like kind of a nice, relaxing, gentle massage. And I think a lot of therapists, are afraid to like hurt a pregnant lady. And like I said,
Yeah.
I mean, you've got to be trained in prenatal massage. You got to know what you're doing. But we're at like our fiercest when we're pregnant, like we're about to
Yes.
have a baby. So we're
Yes.
not this kind of like delicate flower that is going to break, if you go and try to do a little bit of deep tissue work. Generally, if
Yeah.
somebody has been active during their pregnancy, if they're, working out at least a little bit, they don't have adverse health conditions, like they're going to be okay for us to do some therapeutic work
So
and really get in and work those muscles out.
yeah, definitely tell your background and everything before you have your massage. That didn't think of that. That was
Yeah,
good.
yeah.
So, is there any like technique that might surprise our listeners in terms of like how effective it is? Or what is like your go-to technique that you're like, this one you're gonna love it. All my clients love it.
So I just think of like when I was pregnant, you're sleeping on your side and you're kind of curled into the fetal position into a little ball.
Yeah.
And so everything on the front side of your body is short and tight, as a generalization. So I really like to open up the front line, especially even postpartum, like you tend to kind of curl forward, you're breastfeeding baby, like your shoulders round forward. And even moms will have like some wrist pain, from feeding baby, carrying baby. And so let me back up to pregnancy though.
No, you're good.
But yeah, opening up that front line and like stretching the psoas muscles, that's wonderful. I use this contract relax technique where I have clients on their side and I have them bring their knee up to their chest. And then
Okay.
I'll provide a little bit of resistance against them. And then they have to like, so they activate the muscle, and then as they let go of that contraction, I take them further into a stretch, and it's like night and day immediate improvement in range of motion and flexibility for them. So that's a really effective
Love it.
technique. Yeah. People love that, and it's just like, oh, that was the relief that I
Such
needed, like when you have that pain in the front of your hip, like that's
yeah,
amazing. Yeah. um so
I
yeah, I mean
love it.
contract relax techniques is my bread and butter, honestly. Like I can do deep tissue, I can do deep tissue on a pregnant lady, but like the contract relax and getting them like incorporated and active in the massage is like it gets such better results. It's
It's
not even
everything.
funny. Yeah, it
It's
like cuts my
everything.
time in half. Yeah, it's
Okay,
great.
so not everyone has access to a massage therapist. So I know you mentioned the foam roller, and you don't
Uh-huh.
need nothing fancy. A cheap one will do just fine. But is there anything else that a mom can do at home to like either help manage or help prevent hip pain during pregnancy?
Yeah, and I think I talked a little bit about this in the beginning too. Of, being mindful of hydration and your nutrition. The foam roller is an excellent tool. Your sleeping position also, like when you're on your side, and they actually have released some recent research that it really doesn't matter which side. It used to be like you should be on your left side, and now they're kind of saying it doesn't actually matter which side you're on. But
Mhm.
definitely starting in that, second trimester, you're going to be on your side for sleeping. So you want to make sure you have a pillow that keeps your head in line with your spine. You don't want to be kind of
Okay.
cocked down towards the mattress. You don't want to be like this with a pillow that's really high and kind of cricking your
That
neck like that. Keeping that in line. And then also I like a pillow underneath both the knees, the ankles, and even if you can get a big body pillow that will also give you room to keep your elbow and like your forearm on it, because that keeps you from kind of getting crunched in with your chest muscles, and sometimes you might develop like some numbness and tingling in your arms from if you're kind of like get your arms funky way when you're sleeping.
yeah,
So yeah, maintaining kind of a neutral spine while you're sleeping is excellent. That'll do a lot for you. And yeah, I mean that those are the basics. Like
I
just
love
just
it.
paying
I
attention to your
think that's
body,
yeah.
and don't not letting things, pile up, because it's
I
your
mean,
body's
as
gonna
a
try to tell
mom,
you in the beginning. Yeah, because it's only gonna get harder once the baby's around, and then you got to take
yes,
care of them, and then they're a toddler, and like,
I think we all need that
so
mental note, a sticky note, just to take care of yourself. They need you. Take care of
y-
yourself. We all need that
yeah.
reminder.
Yeah, and it's like don't try to look up everything. Like I remember when I was pregnant the first time, I was, reading which, baby carrier to get, which bottles. Like you're doing all this reading, trying to figure everything out, and it's like just take it a day at a time. Learn about one thing at a time. Like
Yeah,
you've got 9 months to prepare, and then even then there's a lot of things that, come
yeah.
your
The
way
baby.
once babies. Yeah, like you don't have to have everything ready to go and figured out the day that they arrive.
No, because it might change by the time that baby comes because they're all different too.
Yep, for
So,
sure.
how about postpartum care? It's just as important as you're carrying your baby. So,
Yeah.
what advice do you have for moms who are still dealing with the hip pain even after birth? Because for me, I had SPD,
Okay.
symphysis pubic disorder.
Mhm.
And they're like, "Oh, it'll go away after you give birth." So I was like, "All right, cool. Get out of the hospital. I'm still having hip pain." A week later, still having hip pain, and I mean, 7 years still having hip pain. So, what are some advice that you can give a mom that's still dealing with hip pain after giving birth? Like, what are some of the things that they could do to uh, help not prolong it as long as I did? Because what I know now, I wish I knew then, type
Yeah, yeah.
situation.
And unfortunately, that's the way a lot of us, learn and get help too, is like just finally getting tired of it and asking for help. So that's my biggest thing. If you're somebody who immediately has hip pain still after birth, like, and maybe you start trying to rehab yourself, and when you're ready, you start trying to do some exercises at home, start trying to go for a walk. And like, if an increase in activity is aggravating your pain, it's definitely time to go to a professional and get some help. And whether that's a massage, a lot of women will start out with that, and if that doesn't provide lasting relief, pelvic floor therapy is an excellent resource. Because what happens is, your body now has started to try and like shrink back to its previous state. The relaxin is dissipating from the body. So there's a lot of change that happens after pregnancy as well. And we don't talk about that because then everything's about baby, right?
Yeah.
So it is a really good idea to try and start doing some strength exercises. But if you aren't sure where to start, there are some resources on YouTube. Things like glute bridges, things like really, I mean, just going up and down the stairs with an added load of the baby, like that is going to help strengthen you over time carrying the baby around.
Hmm.
But yeah, I mean, I would encourage women to like just not try to drag it out. and dealing with their pain. Like, even though, yeah, postpartum, you got a crazy amount of things to adjust to, but like, make yourself a priority to go and get help. Don't just ignore it, because the longer pain is, bugging you, and the longer that you have some sort of dysfunction in your body, it's generally not going to get like spontaneously better over time. And then especially if you're under stress makes everything worse. So yeah, just I would say try and, seek out help.
Yeah,
Yeah.
definitely. That, like I said, I wish I knew about the pelvic floor therapist after I gave birth because I think that
Yeah.
would have alleviated so much of my issues that I have. But no, I mean, no, it's 7 years ago, but 7 years ago, so much has changed, and it was more like, oh, it's fine. You can live with it.
Hmm.
You're going to be okay, and that should never be the answer.
Yeah.
So now let's debunk a few myths. Are there any common misconceptions about prenatal massages or hip pain that you hear often and want to set the record straight? Because I know you did mention before, like, hey, you can have a massage therapist or a massage in all three of your 3 trimesters.
Hmm.
So is there
Yep.
like anything else that you can just squash right now?
Yeah, I think the biggest misconceptions that I hear people asking about is the first trimester massage, not being safe. It is. Um, the acupressure points, thinking that that's going to start labor or, in any way harm the body. It's not.
Okay.
Babies actually really like massage too. Like, I'll be working on clients and their baby will start kicking while they're in the session. Like, it's really good for them too. It helps moms and babies bond. Like, it's really beneficial. And it helps with your mental state too, with, hormone regulation, reducing stress. But those are the big ones. The cushioning system is another one that's kind of, sometimes a misconception and hotly debated. I think there's just fair debate on both sides of, lying on your side for a prenatal massage versus using those cushions. I think they're both fine. There's going to be people who argue till they're blue in the face about both of those, and I'm kind of like, however you're comfortable, like, it's generally safe.
Okay.
Um,
So is there anything you wish more moms knew about their bodies during pregnancy and how to care for them? Or is there something that
I
you suggest to your clients that they can do
yeah,
more of?
yeah, I think the biggest thing is just knowing that your body's going to change slowly over time, and you don't have to
Yeah.
have it all figured out like day one. Um
Yeah.
and that it's normal to have so many different changes, like you're gonna have different mental states, you're gonna be forgetful sometimes, like you're gonna not be able to sleep well, and it is all normal, it's common.
Yeah.
um yeah, I think, and also just knowing that, like, yes, there's pain that comes with pregnancy, but it's it's manageable. There's a lot of things that you can do to help try and keep yourself healthy during pregnancy, and
And
that's
not be
also
scared to ask those questions too when you
Mhm.
get a pain. I mean, contact somebody, obviously your OBGYN, but also if they're not answering, because I had a bad OBGYN that never returned any of my calls. So
Mhm.
there's people out there that will answer the questions for every little pain that you might have or how you feel.
Mhm. Yeah. And that's you're right. It's tricky, they because you've got all different, types of medicine and insurance and things that are covered and things that are not. And so that just kind of adds to the complexity of, getting help. And so if your OB is not helping you with what you're experiencing, then
Yeah.
keep looking for different professionals, PTs, massage therapists, chiropractors. Chiropractic is perfectly safe and great for pregnancy as well. I have a ton of clients that get chiropractic adjustments as well. And there's the only thing I'll speak on with chiropractic is there's a technique called the Webster technique, which is
Okay.
for pregnancy. So it's a good idea to find a chiropractor who is knowledgeable with that type of technique. Um, but yeah, I mean, there's help out there, and it can be difficult to find, but hopefully, this helps people get some resources lined up to get some help.
Yeah, absolutely. So we're coming towards the end, and Janelle, you have been absolutely fantastic with this conversation. You've added more than I could even think about asking. You brought up some questions that I felt like I needed to ask for more information. I know our listeners will be excited to put your advice to practical use. But before we go, can you let us know where people can find you and learn more about your work? I know you're in Virginia.
Yep. So we have our main location in Virginia Beach. We're near Town Center. It's pretty centrally located in Hampton Roads. We do have a satellite location down in Moyock, North Carolina, which is just across the border from Hampton Roads. And then we are active on Facebook and Instagram. So if people want to watch some of our videos and kind of get familiar with us on there, we'd love for people to follow along. We do a lot of educational content as well. And we do have a team of several therapists that are trained in prenatal massage and different techniques. So if we can be useful to anybody going through pregnancy or
Yes.
afterwards, we're here to help.
So even if, so say they're not in Virginia, could they, message you or email you and ask you a couple questions on maybe what to ask a
Yeah.
massage therapist that's out of state? Would you be comfortable with that?
Oh yeah, absolutely. I help
Okay,
people all the time when they're even like when they're moving to try and find the right keywords to find a therapist in their area. So yes, I can help with that.
perfect. So thank you again for joining us today. I hope everyone took away some valuable tips to how to manage hip pain, to stay proactive during pregnancy, and don't forget to subscribe to more helpful episodes, and we'll see you next time.